While the general population still awaits their chance at getting the COVID vaccine, we are speaking with the experts about what you should know in regards to debunking myths you may have heard. Joining us right now to talk more about it, Dr. Abha, good morning. She's an internal medicine specialist.
Good morning.
Well, let's talk about some of these, I guess, myths, if you will. And one I feel like I've heard quite a bit lately is that people are against getting the vaccine because it was produced so fast, and that it can't be right if it was so fast.
That's right. Good morning, Mr. Avery. One thing I want to remind the general public of is your indecision is okay. We'd rather you have questions and concerns than go into anything blindly, and that would include this heroically paced vaccination that will hopefully open up schools, businesses, and travel quite imminently. But yeah, it has been developed quite quickly. But what I want to remind people of is this: any trial undergoes 3 phases, 1, 2, and 3, and all 3 phases involve thousands and thousands of volunteers ahead of its rollout. So that aspect of the vaccine was never sort of forsaken.
Can you talk a little bit about maybe the differences in the vaccines that are currently available, maybe Pfizer, Moderna, and obviously AstraZeneca and maybe Johnson & Johnson to follow? What are some of the differences?
Certainly. So the 2 available vaccines that America is most blessed to have a 95% efficacy. That is that the likelihood of your getting infected and or passing it on maybe to a robust extent may be very limited, very, very low. Ages of eligibility sort of differ. Pfizer tested 16 and older as opposed to Moderna testing 18 and older. So please bear that in mind when you see the rollout, why the age differential occurs. It's because of the ages that were tested. Both are 2 injection doses. Both require 3 to 4 weeks separation in order to allow for our bodies to build robust immunity before the second dose is offered. It's a very novel approach to vaccine development in that an mRNA is utilized. That is a very fragile genetic particle. Hence, it has to be maintained at extremely low temperatures. And you've probably seen that minus 94 degrees for Pfizer degrees Fahrenheit, minus 4 degrees Fahrenheit for the Moderna. That's not something you need to be as concerned about. Just be aware. There are 2 currently approved, with many more in the pipeline. The United States has contracted with 6 companies total. 4 are still yet outstanding and have not asked for emergency use authorization, to include AstraZeneca, based in the UK, and Janssen Pharmaceutical in Belgium.
So let's talk about this real quick here, Doctor. I've heard people say, too, that they're looking forward to getting the vaccine so they can stop wearing a mask. That's not necessarily true, is it?
You know, that is not necessarily true, Mr. Avery. And the reason is this: while we, as those who have received the vaccine, may be protected from a low-grade or robust infection, we yet still do not know if we're capable of passing something on to our neighbor. And so until 80% or more of us are vaccinated, I would ask that we all still continue to utilize the same common sense behaviors that have been touted from the beginning, that of covering your nose and your mouth, coughing into your elbow, recognizing that your neighbor might not have received the vaccine yet. And so to be mindful of those around us, to include our elders and those who might have had a kidney transplant, those who are vulnerable among us.
Doctor, thanks so much for being with us this morning. I really appreciate it.
It's my pleasure.